Hello, I'm Jonathan Kay from UMass Chan Medical School in Worcester, Massachusetts, reporting for Room Now from Barcelona, Spain, at EULAR 2025. Today, there were several posters about JAK inhibitors, and the first was one from the Jackpot registry, which is a combination of registries from several European Union countries that looked at use of JAK inhibitors and correlated it with various events, such as the FDA boxed warning about cardiovascular and malignancy risk, similar warning from EMA, the presentation of the oral surveillance study at the American College of Rheumatology meeting. And what this found was that there was a drop off in prescription of JAK inhibitors after each of these events, but one that recovered. The largest proportion of JAK inhibitor prescriptions in the European Union tends to be for baricitinib, with a smaller proportion and a decreasing proportion of tofacitinib, and an increasing proportion of upadacitinib and also filgotinib. So this was the jackpot study, poster 0150. And then right adjacent was a presentation by Roy Fleischman on behalf of AbbVie, looking at the combined safety data for upadacitinib, uh, looking at various adverse events and correlating them with disease activity. The oral surveillance study, which identified increased or cardiovascular and malignancy risk in tofacitinib compared to TNF inhibitors, or at least did not identify a similar or lower risk than the anti-TNF therapy. The upadacitinib data looked at correlation between disease activity and the various adverse events and found that cardiovascular uh, events, major adverse cardiovascular events, venous thromboembolic events, and malignancies increased with higher disease activity, as would be expected, because inflammation predisposes to these adverse events, whereas herpes zoster was not increased based upon different levels of disease activity. And the final presentation, the poster 0157, was one which looked at the safety of JAK inhibition in patients with underlying interstitial lung disease, comparing that of JAK inhibitors to abatacept, which is a biologic DMARD that is considered to be fairly safe for use in patients with underlying interstitial lung disease. This presentation found that the efficacy of JAK inhibition in patients with rheumatoid arthritis and interstitial lung disease was comparable to that of abatacept over time, and found that there was no no worsening of interstitial lung disease in patients treated with JAK inhibitors, similar to that which has been observed in the past in patients treated with abatacept. So these three posters taken together show that JAK inhibition is safe in patients with underlying interstitial lung disease. The degree of underlying inflammation in rheumatoid arthritis tends to correlate with the risk of developing major adverse cardiovascular events, venous thromboembolic events, and malignancy, but not herpes zoster. And finally, that the announcement of boxed warnings by regulatory agencies, or the presentation of data raising some safety concerns about JAK inhibitors caused a transient decrease in the prescription of JAK inhibition in the European Union countries, and the overall prescription of tofacitinib has decreased over time, whereas that of upadacitinib and filgotinib has increased, and baricitinib remains the predominant JAK inhibitor used in this European Union registry. For more information about this and other presentations at EULAR 2025 in Barcelona, Spain, go to roomnow.org. And this is Jonathan Kay from UMass Chan Medical School in Worcester, Massachusetts. And I look forward to seeing you again soon on Room Now.